My name is Lucinda Leung. I am a core investigator at VA C-SHIP in Greater Los Angeles. I'm a primary care VA physician there as well. I am also an assistant professor of medicine affiliated with the UCLA David Geffen School of Medicine. As a primary care physician, oftentimes my most challenging patients are ones with both physical and mental health problems. And most people that I see in primary care are reluctant to ask for mental health help. And that is very true within the VA and with the veterans that I care for. Fortunately, the VA recognized this early on, put a lot of money investing in building up primary care so that we can better manage these patients through an initiative called Primary Care Mental Health Integration, or PCMHI, as I'll call it. And I've done a lot of work studying how this policy has impacted the way veterans get their care, how they access mental health services. And what we've found is when you have these models in place in clinics that invest more and use more of the mental health providers in primary care clinic, patients get more mental health visits. And the mental health visits, they're unsurprisingly getting in primary care, one-stop shop. When these programs are in place, we are also seeing more primary care visits. People are finding new mental health needs addressed by me as the primary care physician. And they're also attuning to the physical health problems that I've been trying to treat. But you can't treat one without treating the other. And so that's why primary care mental health integration is such an important model that we continue to build up. Mental health care isn't just the physician in front of the patient, it's a whole wraparound team. It's a nurse care manager that coordinates the different specialists, it's primary care talking to mental health, it's mental health reaching out to specialty mental health services like addiction and hospitalizations if necessary. So there's just too many moving pieces for me to address as a clinician alone. We need to change the system, and that's what got me interested in doing health services research. These models look different depending on what clinic you're in. The way different clinics are integrating care is tailored based on the patients that they're serving locally. And so we have recently looked in our VISN, our region of VAs, and surveyed primary care leaders to be able to ask them how integrated care looks like. And the answer is it looks different from place to place to place, which is our guess. But the fortunate piece is that for conditions that primary care mental health integration aims to treat, like depression, anxiety, the satisfaction rates are quite high. Primary care is very happy that mental health is next door helping us. I think that with that knowledge, we're able to work together with our operational partners in the VA Office of Primary Care and the Office of Mental Health and Suicide Prevention, and in the National Primary Care Mental Health Integration Program Office to be able to continue these evaluations and to feed it back directly to the leaders who make decisions on how veteran care is delivered. I have primary care clinic leaders that I meet with every other week who tell me, largely echoing a lot of the things that I'm seeing, but it's great to get that confirmation that these are high priority areas that need addressing. It really is such an honor to be a VA physician. First of all, to be able to work with colleagues who are driven by a very similar mission in an organization that really focuses on just taking the best care of the veterans who are in front of us.